ketamine, when we do them in a side-by-side comparison, both are believed to induce the plasticity through a convergent mechanism through mTOR and BDNF.
Hmm.
But the effects of ketamine in humans and in animal models wear off after about 2 weeks.
Hmm.
And we have seen that. Other people have seen it in human therapy. You have to go back for repeat treatments for ketamine. They don't last for 4 years, as in the case of some studies with psilocybin have shown. Um, so there's a fundamental difference in something beyond just this convergent glutamatergic mechanism inducing BDNF and plasticity, where psychedelics have the capacity to maintain whatever that therapeutic effect is, whereas for ketamine, you're back to a baseline depressed state within a week or two. And so
Yeah.
that's some
I've,
of
I,
what we're trying to do in the lab now is look at these longer, later time points and identify what those changes are.
I see that. Yeah. I've heard that before. That ketamine's antidepressant like effects are not as robust and don't last as long as things like psilocybin. So is that a pretty reproducible finding?
Right. Yeah. Several laboratories have shown that ketamine wears off um, very
Is that
quickly.
like I have seen, I live in Seattle, but I've seen these in a number of cities, but I see these ketamine clinics all over the place now. What, I mean, are you guys seeing that too? Is there any, do you have any concern about how common those types of clinics are becoming?
It is concerning because it's really off-label use for a lot of ketamine. It's just somebody who has a strip mall clinic come in, give them their injections, and I think one of the reasons for that was that there was really kind of no medical billing code and insurance reimbursement. But I think they had a medical billing code a few months ago that was released, and insurance is now starting to reimburse more, and that's going to, I think, have more qualified physicians who have been through that training to use. The only FDA approved use of ketamine now is Spravato, which is the nasal spray for depression. Everything else is really experimental or off label, and it's unregulated.
What do you say?